number of activities, but I work for the organization called CGP. I think we are welcoming you here for validation, and as we know that most of you participated in our initial activities.
We struggle when we have a public health emergency. Many people, right from the sub-national level all the way to the national, we are not quite sure who to report to, what to do. So this will be a very nice tool that is standardized and evidence-based, and it's going to guide us in the way we detect our outbreaks, the decisions we make about response.
It's highly likely that if we embed this within the EMR systems, they can actually be able to pick that suspect case from the get-go. So that first level for detection is going to be sorted out really quick. The challenge that we are going to figure out how to manage is how to link the AP data.
Concerning the tool or the validation checklist template, as well as the what we call the CMEX, that's the simulation exercises. And then thereafter we were put into groups. That's 5 groups, and each group was assigned some tasks to do.
The background of the scenario is on 3rd January 2026, a tanker transporting chemical solvents from Nairobi's industrial area to Mombasa overturned near the river, releasing toxic chemicals into a drainage channel flowing into the Nairobi River. Communities downstream began reporting symptoms consistent with acute chemical exposure, experiencing nausea, dizziness, and cough. Informal water use continues downstream for irrigation and domestic purposes.
So as the health facility struggled with the limited ORS and IV fleets, local media began reporting on a mysterious waterborne illness, sparking community panic and rumors that industries are poisoned the water. The situation escalated further when a trader who attended the funeral fell ill across the border in Tanzania, prompting a cross-border alert and concern over potential regional spread.
One Health activation at this stage. Yes, we have seen that there are both cases of human and animals, and we felt that we should need to notify the COHO, the county, as we notify the NPHI.
So at this point, Lagat, we want to hear some comments as part of the debrief. And these comments should not be restricted to anyone, but we want to hear from the counties. We have representatives from the 5 counties.
Just I was trying to connect the DMT-PHE and the adult, and at what time our county is expected to report the event in the adult application, because it is actually there. So we wanted actually to get a clear guidance of the same. We first confirm, or rather have reported that the county is expected to.
Sometimes you don't even know what kind of support. And if you are here yesterday, you heard there were multiple sources of reporting, and there was no clear protocol of communication. And I think this is going to clarify this, and we are going to know the level of response and the level of coordination, and of course the governance and reporting.
This engagement will go a long way, and I trust that Eldoret, being a transit city, issues of airports hit us so much, but the public health emergency were able to moderate on how best we were able to communicate to them.
It must be made clear that when we get to this threshold, then it is time for you to escalate and move it to the next level. And that is how the whole idea about this particular tool was brought about.